Welcome, dedicated coding students. Today, we are delving into a critical chapter in ICD-10-CM, diseases of the blood and blood-forming organs. This chapter is not only intricate, but also essential for accurate coding, as it covers conditions that form the backbone of our body's functionality: blood, bone marrow, and supporting organs. By the end of this session, you'll have a solid grasp on how to code these complex conditions, a skill crucial for ensuring effective patient care and appropriate reimbursement. Blood is quite literally the lifeblood of the human body. It transports oxygen and nutrients to every cell, defends against infections, and helps heal wounds. Disorders in the blood can lead to cascading health issues, affecting every system in the body. That's why precision in coding these conditions is paramount. Whether you're dealing with anemia, coagulation disorders, or rare genetic blood diseases, your accuracy directly impacts patient outcomes and the quality of care they receive. Before we dive into specific conditions, let's get familiar with the key terms that will guide us through this chapter. Erythrocytes, red blood cells. These cells are responsible for carrying oxygen from the lungs to tissues throughout the body. They're packed with hemoglobin, the protein that binds oxygen and gives blood its red color. Leukocytes, white blood cells. The body's defenders, these cells fight off infections and foreign invaders. Leukocytes are divided into granulocytes, which contain granules in their cytoplasm, and agranulocytes, which do not. Thrombocytes, platelets. These are small cell fragments essential for blood clotting. Without platelets, even a minor injury could result in life-threatening blood loss. Coagulation, the complex process by which blood forms clots to stop bleeding. It's a finely tuned cascade involving various proteins and cells that work together to seal wounds and prevent excessive blood loss. Now, let's establish a systematic approach to coding from this chapter. Every time you encounter a case involving blood or blood-forming organs, start by reviewing the instructional notations at the beginning of Chapter 3. These notations aren't just suggestions, they're your roadmap to accurate coding. Always make sure to go to the tabular list to verify your code, read the full descriptions, and follow any guidelines, symbols, and conventions that apply. One of the most common conditions in this chapter is anemia. However, anemia is not a one-size-fits-all diagnosis. It can arise from various causes, each with different implications and treatment strategies. Let's explore the major types of anemia. There's nutritional anemias, D50, D53. Nutritional anemias are caused by deficiencies in essential nutrients. These deficiencies can result from poor diet, absorption issues, or increased nutritional demands, such as during pregnancy. Iron deficiency anemia, the most common type, often seen in menstruating women or individuals with chronic blood loss. It's characterized by microcytic, hypochromic red blood cells, meaning they're smaller than normal and contain less hemoglobin. When coding this condition, look for documentation that specifies iron deficiency. Vitamin B12. Deficiency anemia, also known as pernicious anemia when caused by a lack of intrinsic factor, a protein necessary for B12 absorption. This type of anemia can lead to severe neurological complications if untreated. When coding, make sure to distinguish whether the anemia is due to a B12 deficiency or a lack of intrinsic factor. Folate deficiency anemia. Folate is crucial for DNA synthesis, and its deficiency leads to macrocytic anemia, where red blood cells are larger than normal. This is particularly concerning in pregnant women, as it can cause neural tube defects in the fetus. Proper coding requires documentation that specifies the type of deficiency. Always verify these codes in the tabular list, ensuring you've captured the correct type of anemia and following any applicable guidelines and conventions. Hemolytic anemias occur when red blood cells are destroyed faster than the bone marrow can replace them. This can happen due to genetic conditions, autoimmune reactions, or external factors like toxins. Sickle cell disorders, perhaps the most well-known hemolytic anemias. In sickle cell disease, the abnormal hemoglobin causes red blood cells to assume a sickle shape, leading to blockages in blood vessels and a host of painful complications. Coding these conditions requires you to note whether the patient is in a crisis or experiencing other specific complications. Thalassemia is a group of inherited blood disorders characterized by abnormal hemoglobin production. 2. Depending on the type, alpha or beta, the severity can range from mild anemia to severe forms requiring regular transfusions. Ensure that the documentation specifies the type of thalassemia when coding. Acquired hemolytic anemia. is unlike the genetic forms. This type of anemia can result from infections, medications, or immune system malfunctions. Your coding should reflect whether the condition is immune-mediated or due to another cause, so be sure to review the documentation carefully. As always, after selecting your code, go to the tabular list to verify the full code description and ensure that all relevant guidelines are followed. Aplastic anemia is particularly serious because it involves the failure of bone marrow to produce sufficient blood cells. Idiopathic aplastic anemia, a rare, life-threatening condition where the cause is unknown. The bone marrow fails to produce enough red cells, white cells, and platelets, leading to pancytopenia. When coding, make sure that the documentation supports the idiopathic nature of the anemia. Drug-induced aplastic anemia. Certain medications can damage bone marrow, leading to aplasia. If the drug is known, make sure to specify it in the coding process. Shwachman-Diamond syndrome, a rare genetic disorder that affects the bone marrow, pancreas, and skeleton. This condition requires specific and accurate coding to capture its complexity. Verify all codes in the tabular list to ensure they accurately reflect the condition's details. Next, let's look at conditions that affect the body's ability to clot blood. Coagulation. Defects in hemorrhagic conditions. D65, D69. These disorders can be life-threatening due to the risk of prolonged bleeding. Hemophilia, a genetic disorder where the blood lacks sufficient clotting factors. Patients with hemophilia need careful management to prevent and treat bleeding episodes. Coding must indicate the specific type and severity of hemophilia, so always review the documentation thoroughly. Von Willebrand's disease, a more common genetic bleeding disorder than hemophilia, involving a deficiency or dysfunction of von Willebrand factor, which helps platelets stick to blood vessel walls. Again, specificity in coding is crucial. Verify all codes in the tabular list. There's also COVID-19-associated coagulopathy. The COVID-19 pandemic has brought new challenges, including a rise in coagulation disorders associated with the virus. These include disseminated intravascular coagulation, DIC, which is coded under D65. Be vigilant in capturing the association with COVID-19 in your coding. Now let's look at other blood disorders, D70, D89. Finally, this chapter also includes a range of other disorders affecting the blood and blood-forming organs. Neutropenia, a condition characterized by low levels of neutrophils, increasing the risk of infections. Neutropenia can be congenital, drug-induced, or due to other causes. Pay close attention to the underlying cause when coding, and always verify your code in the tabular list. Methemoglobinemia. This condition involves an abnormal amount of methemoglobin, a form of hemoglobin that cannot effectively release oxygen to body tissues. Coding should reflect whether the condition is congenital or acquired. And as always, verify in the tabular list. Heparin-induced thrombocytopenia, HIT, is a serious reaction to heparin, a common blood thinner, leading to a dangerous drop in platelets and increased risk of thrombosis. Coding must indicate the type and severity, so review the documentation and verify in the tabular list. Coding practice and case studies. Let's apply what we've learned with a couple of case studies. We will look at familial polycythemia. This condition involves the overproduction of red blood cells, leading to thickened blood and increased risk of clotting. To code this, start by finding the main term polycythemia in the index, then locate the modifying term familial. Remember that the modifying term is descriptive, meaning it is explaining what type of polycythemia our patient has. The correct code is D75.0. Always verify this code in the tabular list to ensure it aligns with the patient's documentation. Now, let's look up congenital methemoglobinemia. To code this condition, locate methemoglobinemia in the index, followed by the modifying term congenital. Remember to verify in the tabular list and follow any applicable guidelines. The correct code is D74.0. As you continue to practice, remember that your role as a coder is critical. The accuracy of your coding doesn't just affect billing, it directly impacts patient care. Missteps in coding can lead to miscommunications between healthcare providers, incorrect treatment plans, and ultimately patient harm. But don't worry, you've got the tools and knowledge to succeed. Keep practicing, use your resources, and don't hesitate to ask questions. Every time you code a case correctly, you're contributing to better healthcare outcomes. And that's something to be incredibly proud of. Your attention to detail and dedication to learning will make you an invaluable part of any healthcare team. Remember, always verify in the tabular list, follow the guidelines, and keep up the great work. Thank you for joining me today, and I look forward to seeing you in our next session.